Gupta. I am sitting in Delhi Apollo Hospital. Today is 6th of December 2024 and I am sitting here on CSI TV during the 76th annual Conference of Cardiological Society of India. So in the interest of the audience, I will be talking about how to heal your heart from prevention to intervention. Heart is a muscular organ, as we all know, and there is only one heart, and therefore we have to take care of heart very well. Heart is very important and crucial for life because heart is supplying the brain, which is the seat of life. If heart stopped for a few seconds only, the brain will suffer, and if it is stopped for 1 or 2 minutes, patient will die. Of course, there is always a possibility of revival within 3 minutes of cardiac arrest, but that can also lead to organ damage of the brain. It all depends upon how good we are doing cardiopulmonary resuscitation after the cardiac arrest. So we don't want cardiac arrest. So how to keep your heart healthy and why it is important? I told you it is important because heart is actually giving seat of life. So heart is a muscular organ. It is itself being supplied by coronary arteries, which are 3 coronary arteries, 2 on the left side and 1 on the right side. These coronary arteries are actually important because they supply oxygen to the myocardium. Any blockage in these coronary arteries leads to heart attack or angina. Why these coronary arteries are so difficult to manage? Because these arteries are very thin. The diameter of the coronary artery is not more than 3 mm to 4 mm, and if you go down, it is 2.5 millimeter. So these are very thin arteries which is supplying the whole heart. Right coronary artery supplies about 30% of the myocardium, circumflex about 15%, and the rest is supplied by left anterior descending artery. So why the few people will survive heart attack while few will not survive heart attack? It all depends where the blockage happens. If the blockage happens in the proximal part of the left anterior descending artery or proximal part of the right coronary artery or left main artery, then these patients are likely to have a severe heart attack, and sometimes it leads to sudden death. And therefore we all fear from heart problems. So how to keep your heart healthy? To keep your heart healthy, you have to do a regular checkup. Recently we have realized and we have seen, especially after COVID, that young patients, young people, young 30-year-old, 25-year-old, 35-year-old, 40-year-old, they have suffered from severe heart attack and sometimes death. We have witnessed death during gym. We have witnessed during treadmill test or during the exercise, routine exercise, or on the field, or while singing. So this has happened because I presume that COVID was a bad era, and COVID spike protein was responsible for making the plaque more vulnerable to rupture, and that leads to heart attack. Okay, coming on to what are the way to prevent your heart, to keep your heart healthy. Regular exercise is important. We all know that walking at least half an hour or 30 minutes should keep your vagal tone up, and therefore reducing your basic cardiac rate, and that helps in prevention of heart diseases or blockages. Number 2, if you have a high blood sugar, you have to control it, diabetes. Number 3, if you have high blood pressure, you have to control it. A lot of patients of hypertension, they do not want to take medicines for long or lifelong, and they don't of course check the blood pressure, and these patients actually are more vulnerable, more susceptible, more prone for having heart disease. So therefore, if your physician has prescribed you or cardiologist has prescribed you medicine to control your blood pressure, please don't shy away from it. Number 4 is cholesterol. We all know high blood cholesterol leads to more aggressive cholesterol deposition inside the coronary artery, and therefore regular lipid profile testing is important. And if the most important is having the peace of mind, which is not there. Most of us do not have peace of mind. We do not feel happy, and we are most of the time stressed. So keep your stress away. It's not easy. How to keep your stress away? Keeping stress away is something, if you are a human being, you will be stressed out because of your work, because of your family, because of your money problem, because of financial problem, or because of political reasons, not political reasons. So how to keep your stress away? This is the only way. It's not easy. But if you start believing in God, if you start believing that what God is doing is the best for you, then at least for some time you keep your mind at peace. And lastly, I would always suggest that you should have a good sleep. If you sleep well, 6 to 7 hours, 8 hours a day, depending upon your requirement. Everybody has different requirement for sleep. There are few people who will have good sleep at 6 hours, few people will require 8 hours, few people require 7 hours. So if your requirement is 8 hours, try to have 8 hours sleep. And that everybody knows how many hours of sleep will give him a total freshness in the mind. And now I would like to concentrate upon how to treat your heart. If you have a coronary blockage, if you are advised coronary angiography, then please don't avoid it. There are few tests which will confirm whether you have blockage or not. There are two tests only. One is, of course, treadmill test. Treadmill test is an exercise on the machine, and we see the ECG during exercise and after recovery. And if there are ECG changes there, then that treadmill test is considered to be positive, and positive for ischemia. That means there are chances of having more than 70% blockage. Mind you, a normal TMT does not confirm that you don't have blockages. If you have 30% block, if you have 40% block, if you have 50% block in all the three arteries, even then the treadmill test will remain normal. And therefore it is not a guarantee that you don't have blockage. And 30% blockage can lead to heart attack. So what is the way out to confirm whether you have 30% blockage or 50% blockage? Of course, coronary angiography, which is done through the radial wrist artery or the groin artery, which is femoral artery, is the gold standard. But coronary angiography is not required to be done in all the patients. If there are specific indications, especially the acute coronary syndrome, like heart attack or anasthenia, unstable angina, these patients will require direct coronary angiography. So those patients or those people who have a strong family history and they want to be sure that they do not have any blockage, the best is CT coronary angiography. CT coronary angiography is a radiological test which, by injecting the dye into the vein, and you take a CT scan, 64 slice, 128 slice, 256 slice, you cut the heart by the machine is cutting and make a full diagram of the coronary arteries plaque for plaque. So CT coronary angiography should be done in all people, I would say, even healthy people after age of 40, at least once in 5 years or once in 10 years. If there are no blockages, you are assured. If there are blockages, then you have to repeat every 3 years and you consult the cardiologist to give the best medicine so that the blockage may come down or they should not progress. There are two things. Either they should come down or they should not progress. So these are, I have told you in summary how to keep your heart healthy. Intervention is required when you have major blockages more than 70%, and that is coronary angioplasty or bypass surgery depending upon number of blockages. These days, for example, personally I try to do lot of complex angioplasties where we avoid bypass surgery even in a triple vessel disease. Most of prostate patients want to avoid bypass surgery because of course you have to open the chest and it takes more time to heal. It takes recovery is about 1 month or 14 days, 15 days and back to work in 2 months. While angioplasty you can do within half an hour, patient discharged after 48 hours, patient is back to work after 22 hours. So I would say that angioplasty is always doing better. Coronary stenting is a big revolution. It was started first in 1987. Now with the drug-eluting stents, we are able to treat many blockages with the help of non-surgical coronary angioplasty and stenting. Thank you very much. Keep your heart healthy and enjoy peace of mind, and of course try to keep smiling and try to keep away your stress by believing in God. Thank you very much.
That's good.